Thanks and welcome on behalf of the Department of Engineering Professional Development and our great panelists here. I'd like to thank you and thank the Gilson series and Rath for inviting us to share one of our successes in bringing the tremendous resources of the University of Wisconsin to the people of the state and of the world. Engineering Professional Development is a full department within the College of Engineering with a very unique mission. And that mission is to do adult continuing education and make that very meaningful. So taking the research that's done on this campus and finding ways to bring that to daily engineering practice. We do that through a series of engineering short courses, more than 400 a year. We touch more than 13,000 practicing engineers and technical professionals every year. We have Master of Engineering degrees that we offer in the online environment, in things ranging from technical leadership all the way to internal combustion engine design. So our department is very focused on the Wisconsin IDEA mission. Our department chair reinforces that on a daily basis. And when we have our discussions within our workplace on what we are going to do, we always do it with the idea of the Wisconsin idea in mind. And so I'm very privileged to work in an organization that maintains mission focus. Our department chair, Phil O'Leary, gave us, Frank and I, a challenge, and another colleague, Jeff Elke, who can't be with us this evening, gave us a challenge that came to us one day and said, you know, there's a lot of companies out there that struggle, and they struggle as spin-offs. And these spin-offs seem to have the same problem, is they're doing okay in science, and they do great in science, and they do okay in invention, they do great in invention. But it's taking it to manufacturing where they stumble. And it's, can we take some of our resources within the Department of Engineering Professional Development, EPD, and take those resources and help these folks understand how to improve their design, how to improve their manufacturing processes, how to think about manufacturing before they're scaled up into full production. And so I said, well, sure, we can do that. Hey, Frank, why don't we go over and have a beer or two and talk about how we could go about doing this. We got engaged Neil from the Wisconsin Small Business Development Center here on campus, and Neil Lerner. And we went and got a grant and found a couple companies, and one of the companies is here with us tonight, Neoclone, to figure out how do we bring traditional manufacturing engineering, industrial and systems engineering concepts and apply them in very radical ways to this emerging biotech market. And so that's what we're going to talk about tonight. I'm really just here as head count, so I get to smile and do the introduction and then turn it over to my colleagues. But I do want to give one plug of recognition for our department. And if you haven't seen the latest U.S. News and World Report rankings on online engineering education, I'm sure everyone has, but I'm just going to be reinforcing, and we have these out there. Our programs were ranked number 1 in 2 of 4 categories, number 4 in the other, 5 in a third, and 1 we don't apply. So it's a very different ranking system, but when you're first twice, you know, that's really a tribute to what our department is about and how we design things to be relevant for the students. A major element in this was how the design of our programs impacts students. And now we're looking at a way of how the design of our activities impact businesses in Wisconsin and globally. So the first person I'm going to introduce is my colleague Frank Rath. Frank is a faculty associate in the Department of Engineering Professional Development. Comes with a background in industrial systems engineering from the University of Wisconsin at both the undergraduate and graduate level. Started out his career at Sub-Zero as a manufacturing engineer 10 years ago, maybe, something like that. has been with our department for 7 years or so, maybe a few more. But Frank brings a unique perspective of bringing, how do I apply concepts from traditional manufacturing environments to emerging production situations. So how do you do manufacturing engineering in biotech? How do you do it in healthcare? How do you do it in higher education? And so I'm proud to say that Frank is a colleague and a friend. And without further ado, I'm going to introduce Frank Rath.
Thanks, Carl. Thanks, Laura, for the opportunity. Really appreciate it. Our plan today is for me to take as little of your time as possible and just give you an overview of this program at the University of Wisconsin in the Engineering Professional Development Department, what we basically do. And then I'm going to turn it over to Devin McClenn, the Chief Executive Officer, Randy Wagner, the Chief Operations Officer, and Nick Wiegert, the Lab Manager at Neoclone. And they're going to share with you their experience in working with us to improve their processes. It's much more interesting to hear it from their words than it is from mine. So I'm just going to give you a really brief overview. Carl talked a little bit about the Wisconsin idea. That kind of pretty much embodies what we do in engineering professional development. We work with a lot of companies, some of which you're going to see in a few seconds on one of the slides, helping them improve their processes, improve their products, improve their operations, okay? And it's really appropriate that we highlight this Wisconsin idea a little bit this year because it's the 100th anniversary of the Wisconsin idea. We work with basically companies in any stage: research, product design, product development, startup production, full-scale production, and order fulfillment. We work with large companies, small companies, startup companies, international companies, OEMs, engineer-to-order companies, making large capital equipment, suppliers, and the initiative that Carl described to you focused on specifically working with biotech companies and medical device companies. I'm just going to take a few seconds to describe our approach, our methodology. In the area of research and product development, we're process people, so we believe that everything is a process, okay? Design, research, order fulfillment, production, everything is a process. And our approach is to apply tools, engineering tools that are effective in industrial situations and in manufacturing across the board to any and all types of companies. The biotech initiative I mentioned, another initiative that was really interesting that we've been involved with for the last several years. You might have heard about this. Tim Oswald's group in the Polymer Engineering Center is also a part of this project, is to develop a new airless tire for the military. You can see that picture up in the right-hand corner there. In the area of research and product development, product design, we focus on defining, evaluating, developing, and improving the research process and the product development process. The types of tools we use are quality function deployment. It's important to understand what you're designing your product or service for. What are the requirements you need to meet in order to be successful? Quality function deployment is a very, very powerful tool to help companies do that. We're very big proponents of defining processes using tools. Process mapping tools. Another tool that we use extensively in our work with companies in improving processes is failure mode and effects analysis. We use it to assess process capabilities, find process weaknesses, improve process controls. In the area of research, basic scientific research, evaluate processes to identify weaknesses and determine whether they're going to be successful in achieving their end objective or not. Therefore, we can prevent dead ends and restarts in those situations. Design of experiments. Big thing we found in our biotech initiative was the lack of in-process metrics, okay? Carl said they have the science. Most of the biotech companies have science down pretty well. They don't think like process people, scientists, sometimes we found. So it was a great opportunity for process people like ourselves to work with scientists. And in all three of the cases that we worked with companies, including Neoclone, was a great marriage between the two. In the area of startup and full-scale production, once again, defining processes using process mapping tools, very, very, very powerful tools. Again, process FMEA, evaluate processes, find weaknesses, improve controls, improve the outputs of those processes. And then cellular flow of products and projects and information. Cellular manufacturing is a very, very powerful concept in manufacturing that can really improve the quality of processes, the quality of products, and the quality of work life, quite honestly, also, and also improve lead time and quality, reduce lead time and improve quality. And we found a great application for this concept in biotech because in some companies, I'm not saying in all, people have a tendency to live in silos or departments, and there's a incomplete or inadequate sharing of information between those departments. And applying these cellular concepts in those companies really made drastic and dramatic improvements in the overall processes. Another set of tools that are unique to the College of Engineering here at the University of Wisconsin focus on developing, defining, and planning capacity, resource capacity. Any process requires resources, people, equipment, laboratory space, etc., okay? And it's really important, and manufacturing operations require capacity also. It's really important to understand that there's a definite relationship between capacity utilization and lead time. In biotech world and in the medical device world, lead time is really important. You know, lead time basically costs you money in the biotech world, doesn't it? Faster to market is better for you and your investors. And it's really important that people understand the relationship between capacity utilization of resources and lead time. And so as you can see, I'm not sure which button is the green button. I was told by the people, the technical people, if I push the bottom button, we're basically screwed here, so I don't want to push the bottom button. Is it the second to the bottom button? Or? Right. There. Okay, so as resource utilization increases, lead time goes up dramatically, and it grows exponentially. And the higher the variability, the more rapid the lead time grows. So if you don't have much variability in your system, you can operate at a planned capacity utilization of your resources around 85 or 90%. As you go to having a relatively high amount of variability in your processes, whether that be research or startup production, or in the biotech world, laboratory processes, more variability means that you have to have more resources if you want to have less lead time, or you can improve or reduce the variability of the processes. So. Results are pretty interesting, and I'm going to focus on the 3 biotech companies that I worked with in the project. One of the things that surprised me when we got into the biotech arena or biotech world is that there's a lot of, I'll call it secrecy in the biotech world, and Devin's company was one of the only 3 that agreed to share their success and tell their story. So we were really lucky that they were very fortunate that they're such nice people, basically, okay? But what we found in the biotech projects, we had 3 projects as part of this grant that was funded for, we got funding for, was that we were able to reduce lead time. Reduce lead time for new projects, reduce lead time for completing and filling orders, completing projects and filling orders. As a result, overall cost drop and quality improved. With that, I'm going to turn it over to the group from Neoclone.
Thanks, Frank. And also, thank all of you for showing up on this beautiful evening. It is really hard to compete with Mother Nature this time in March, so a special thank you to all of you, and of course to the Gilson series for continuing to sponsor these types of events. So we've already had all the preliminaries on what we hope to discuss today. I did want to give you a little bit of background on Neoclone. Neoclone is a world-class developer and producer of monoclonal antibodies. You get sick, your body produces an immune response. It's producing antibodies against that particular illness or disease. Mono, you can make it specific, an antibody specific to that disease, and clonal, you can make that same antibody over and over and over again. So this becomes, the monoclonal antibody is produced, using a manufacturing process. Although it's not a manufacturing process, most guys at Harnisch-Fager would understand. But nonetheless, it is a process. As a company, we've been doing this ever since we've been in business. We were founded in '99, commercialized in 2002. We're now 15 full-time employees. We do about $1 million in sales every year. And since we've been in business, about $7 million total. We have over 600 customers worldwide in 30 countries. And we have a key part of our company focused on developing human antibodies for therapeutic use. And we plan to be in that market later this year. Excuse me. So to give you a background on the project, because I'm really going to let Randy and Nick talk mostly about this, but Neoclone really had an urgent need to change its process. Neoclone had commercialized in a very unique technology that was developed here at the UW and that we licensed from Vieth, that we could ultimately get to make antibodies, but we couldn't do it in a reproducible enough way that was ultimately commercializable. For most companies, that would spell death. But fortunately, for a variety of reasons, Randy and I happened to cross paths prior to this, and so Randy came on board ready to help champion the existing process until we all kind of came to the conclusion that we couldn't do this, and fortunately with Randy's background, he was able to step in and we could change processes midstream. Of course, I had a bias as we walked into this saying everything has to be processed, because if it's not processed, you cannot make money in business. It's my bias. I do not believe people can make money in business unless they have process around how they do that. And Randy's looking at me saying, well, if you want me to do it my way, we're going to do it my artful way. And I'm going, all right, so long as we can get it into a process, because if we can't get it into a process, we'll never make any money at this. So we both recognized that this had to happen, needed to change. To say we had limited resources to enact this is redundant at Neoclone. We've never had resources to enact much, but we've always somehow managed to put it together to make it happen. We also knew that there was no time for ego. If I had a different perspective, Randy had a different perspective, Nick maybe had a different perspective, we had to get over it. We were in crisis mode. We had to change. Change was not an option. In the meantime, I happened to hear Frank give this wonderful talk about how you could apply these engineering principles to science and actually make process out of this. And as soon as he said the word process, I said, Frank, what do I got to do to work with you on this? And he said, I got a deal for you. And I said, it's got to fit with the Neoclone's budget. And he said, well, what's your budget? And I said, not a whole lot. But we ultimately agreed that this would be a good potential win for them to be able to show how these principles could be used in the life sciences environment. And I absolutely agreed that this was necessary for us to survive. That's right. I mean, there was a reason. And because we also still had to keep delivering and selling products and services throughout all this, because if we had stopped or slowed down doing that, we would have died. So it really was a fun period to be thinking about all this, but when we're actually doing it, it wasn't quite as, it's going to seem a lot more smooth and lovely now than when it actually did occur, but absolutely, I work with great people, so it was able to get done, and it's because of them, not because of me, which is why I'm now going to turn it over to Randy.
Thank you, Devin. Thank you, Vieth and Gilson, for sponsoring this, and I want to thank all of you who are here today, especially you entrepreneurs or wannabe entrepreneurs, both the investor side of entrepreneurship and the actual the worrisome side of entrepreneurship. So we're going to start out right away here. Bootstrapping, first of all, great concept. I mean, bootstrapping, and when you're talking about bootstrapping and starting an organization, you know, I always thought I was the greatest. I'd been in academics here in Madison, the best institution in the world, at the Cancer Center for 5 years, and I'd worked to develop core facilities at the Medical College of Wisconsin, spun a small business out and ran it for 10 years on bootstrapping, and basically trying to grow it and build it. Well, I wasn't successful at growing it, but there's a guy right over here to my left by the name of Devin McGlenn, who I have to say is the greatest bootstrapper I've ever seen, in terms of a man who has actually grown a business on a bootstrapping model with very, very little resources, and just an outstanding example of bootstrap. So when I saw Neoclone being represented in this series, I can't think of a better company that should be here talking to you guys. The other person on his left, Nick Wiegert, he's the best production manager I've ever met. He works hard every day. His main goal in life is to make sure that every client has an antibody that works and is to top quality. So Nick is just constantly thinking about how to improve things, making sure the laboratory, everything is functioning for everybody so that everybody can get everything going. So bootstrapping, again, thank you for those guys. Now Frank, I was told I was coming here to roast Frank, so I was actually kind of excited. At first I go, all right, okay, he made me go through this exercise, he made Nick and my production staff go through these exercises, all incredibly painful at a time when we didn't have time for this stuff. So I had 2 pages done in like 10 minutes. I was gonna roast him for 30 minutes, no problem, but I guess that's not gonna happen. Then I was told, well, now you gotta talk about something Frank taught you. God, that even took a lot longer. I mean, I had to sit there and there was one thing, sorry, there's only one thing you taught me, Frank, and that was actually there's a really nice vacation place up in northern Wisconsin, up by Boulder Junction on a lake. Yeah, it's the only place I've ever been able to go with my family. Spent a week with Frank and his family on this lake where you can actually kayak right up to the eagle nest, and their babies are right outside there. So thanks, Frank, that was it. So that's all I have to say. So.
Thanks,
All kidding aside. Okay, now on to my journey. I want to talk a little bit from a journey perspective because everything in life is a journey. And for me, it's been an exciting journey through my career of the last probably 25, 30 years. So the biggest journey I had probably was the transition from academia to biotech business and having my own company. So today I'm going to talk about journey from method to process because that's really where it comes from. It goes, from academics, and then you get Frank jumping in the middle here, and then you go to industry. So Frank is that lean guy. He's already dressed in his green, as you can see, so he's ready for St. Patrick's Day. So it's not a great picture of him, I apologize, but it was the only one I could find. So journey to methods. Now, as all of you know, you see 2 different planets. Academics and business industry are 2 totally different planets in the way that they develop their processes and run their operations. Academics develop things, they have a researcher need as the driving force. They're justified and organized by committees of scientists. Usually those committees are almost all doctors, PhDs, who are interested in science and making sure that their laboratory is being supplemented with something or that they can build it within their own laboratory. But a lot of them feel that these things should be run off of indirects from the grants that come to the major institution. So they're either built as independent entities, like a company within the college, very much like your biotech center is here, or they're built within each department, which seems kind of redundant, but there are institutions that have each of these core facilities within their institution. I did this at the Medical College of Wisconsin, built core facilities. They're usually all methods-based. So when we were taking drugs from benchtop to clinic, when I was at the cancer center over here, everything was a method. We had methods. And each of us technical people, technical scientists, followed those methods. We each had usually 4 things we had to do, and each person would have 4 things they would do, and that's what Devin refers to as the art. There really was science behind it all, though, because scientists have to have all their methods justified, so through experimentation. So those methods all worked. We knew they worked. And again, back to academics, core facilities and research labs are usually subsidized by grants. So they're built up a little different than industry in that you can be lucky and not be funded by grants at all. You can be partially funded or you can be fully funded. Industry is totally different. Development is based on market drive. It's justified and organized based on profitability by the most experienced management teams. So basically when you go to an angel investor group or a VC group or even your relatives, they want to know first, or they should want to know first, who is your management team? How much experience do they have losing? Because you usually learn more from losing than you do from winning. And they're looking at team and team management approach, often before the technology. The technology is sometimes off on the side. There's processes and SOPs are generated. So processes like Frank was helping us develop our lean process. SOPs are standard operating protocols where there's no leverage or room for flexibility. the person follows that letter for letter because they need to reproduce it time after time after time, and it has to work every time. Each process needs to be cost-effective and competitive in the marketplace. So that's another big issue. You're being undercut all the time by core facilities or by people building stuff within that's subsidized, and you have to compete with that. So you have to be lean. You have to compete with other countries throughout the world. Antibodies is probably one of the most competitive areas in industries in biotech, in that there are so many of them because the licenses, and there are no licenses or patents around the actual technology of immortalizing cells for the most part. So each process needs to be cost-effective and lean. Processes must be profitable because if you don't have a high gross margins written into it, it has to be driven by revenues, and you're not going to be here anymore. So it is a lot different than academics, two totally different planets. Now for the real story. In 2007, I had landed my company. I sold my equipment to Primordion in town here and came over and worked with Tom and Chuck for a year, trying to get that company off the ground. After that, I left for Neoclone within a year. And in 2007, Neoclone experienced in the worst way the collision of these different planets, as I was just talking to you about, and concepts. Devin alluded to it just a little bit ago, but basically it was methods colliding with process. Neoclone's largest revenue center was their antibody production services. Neoclone was given a method that worked in academics, as Devin had alluded to, and it wanted to commercialize this shiny new technology. Because when you have something shiny and new in the antibody world, you are more valuable than the other 197 companies in the United States. And Wisconsin, and in that process, made it stand out and would make it when saturated and often failing world of custom antibody providers, which is what I had already just said. This new technology worked very well at attracting clients interested in new approaches. So Devin can sell anything. So basically, he had this shiny new technology here offered at the university, and he could sell it, and he did. But the problem was it failed as a reproducible and robust process in industry. So this happened happens more than one would think. This has happened to another company in town not too long ago. I'm not really going to talk about it, but somebody realized their technology wasn't going to make it, and they stopped the company in time. This happens in the research and development side of large companies like Promega. Oh no, it's never happened at Promega. At other companies, but I'm saying it could happen at Promega, where the R&D group, the R&D scientists develop a really nice product on the small scale, has to go to large scale manufacturing. All of a sudden, boom, doesn't work anymore. We can't scale it up. We're stuck. What are we going to do? So this kind of thing happened, and Frank's team and his personal experience were very, very helpful in helping us at this really important moment. Basically, I walked in, but that's not me, as you can tell. But for those of you who are old enough to remember Happy Days and remember the Fonz, he always went A. So I get done at Primordion, I'm walking to Neoclone going, hey, this is going to be great. I'm going to learn about this new technology of immortalizing cells that makes us all shiny and bright. Something that I've heard about in Milwaukee that, how could I ever compete against this monster? I have a nice high throughput system, but how could I ever compete? So I was going to come in and go A, but no, I wasn't going A. If you all remember Fonzie, he had a problem. He had some word that he could never say. Does anyone remember what that word was? There you go, wrong. Yeah, he could never say he was wrong. So basically, that was exactly the problem Fonzie had, and that was the problem I had. One of the first business experiences I had at Neoclone was to learn to talk to clients and tell them we were wrong. But I would say Neoclone was wrong, and Devin taught me my second most. Do not talk about Neoclone in the third person. But I had reason. It was really kind of, at the time, I was a little concerned. So I wasn't Fonzie at the time. I came walking into this really, really difficult situation that I was not aware of at all. I was coming in business development, not realizing that operations needed a little bit of a makeover. So imagine being Neoclone, or as I would say, Devin McGlenn, midstream, trying to protect your investors' upside by selling catalog products. So they built this catalog to protect the upside. They built this nice service area to help the upside. I got to thank Dick Burgess for that, all those great monoclonal antibodies that started the Neoclone catalog. And they're trying to protect this upside by building out this revenue-generating component to their business while they're going for the home run of what if we can produce human antibodies with their research program. So, that's a large drain on cash, that research group, while we're trying to generate revenues. A fairly large group of employees, there's 12 of us at that time, and our largest revenue generator, your shiny piece, cannot successfully translate into a consistent, reliable commercial process. So like Devin said, that's a real big problem, and most companies would fail at that point. And it did give me quite a bit of stress having just gotten into business development there, and looking at this and understanding this, because what I had thought I was going to learn, I was kind of disappointed with. This is what makes an entrepreneur. I mean, these feelings that you go through, these journeys, so to speak, are what make you entrepreneurs, startup type guys. I'm a startup guy. I like working with the small companies because and I know Devin does as well, because we like this. I mean, it's really kind of sick, but we have a kind of sick enjoyment of this type of stress, this type of torture, so to speak. So it's really all about the journey. It's all about finding solutions to fires that are burning and quickly feeling good about that. But, you know, it is a bit time. Okay, it's stressful. You know, it's stressful, and it's even more stressful. So basically, that's the only trade-off we have is trying to relieve our stress. So we do that. So I brought into Neoclone the possibility of a new, very robust, high-throughput antibody production method that I had developed with the help of UC Berkeley at the medical college, with the help of Phil Kleba, who I thank all the time for having taught me this procedure. I adjusted it in my company for 10 years to make it even work better. I have 20 years experience with a proven successful antibody method, which worked in academics as a method, and in my small assay development company as a method, because that's all I knew, is to give one person, your best guy, your 4 best projects, and going down the line. Devin again told me that's not going to work here. So new antibody developments, I brought antibody development strategies that if people followed some of the things I said, they would be more successful at making antibodies, which is one of the things that we have an advantage over the other 197 companies over, is strategy and developing strategy. This is why Frank's group was so good with us, is because we understood the concept of getting better and seeing that. Neoclone had qualified technical scientists. So we had the best people in terms of hardworking, excited. They're in a young company, they're motivated, ready to go. You know we have a charismatic leader. If any of you have talked to Devin, everyone knows how much energy Devin has. We had a group interested in making the best monoclonal antibodies in the world. Egos checked at the door, as Devin mentioned. There are no egos at Neoclone. So basically, you can say anything to us, and it's just going to brush right off. So don't worry. So come up and talk to us anytime. We're real friendly, and we won't be talking to you about how great we are. Group of hardworking junkyard dogs. That's what I call them, because I always felt like I was a junkyard dog, and that's just what I was looking for in terms of the team that I would be leading in production. Then what did Frank teach us? This is really all about what Frank taught us and brought to us that was valuable. He had valuable expertise in evaluating and understanding process. So we saw that right away. And I saw that the method had to be changed to process. Devin made that very clear to me. We had discussions around that because, again, I couldn't see how one technician would do one part of something, another one would do another, and then they could switch around to do almost like an assembly line. So we're almost comparing one person doing a whole thing through several people being able to do every part of it. So an approach that makes people really examine what they're doing at each step of the process. So that was really what Frank was trying to make our team do. He forced me and the production group to identify and define measurable metrics. So we had to look at this method and then find things that we could actually measure within it. So some people would say, yeah, this is art. This is art and science. This technician actually tweaks something, doesn't put it in the paper, and of course it only works for him. That's why he's in that spot. But the SOP has to have everything in it. The process has to have everything in it. So we have to have measurable metrics. So we had to I had to think really hard to figure some of those out, and so did Nick. I had to work really hard on going, what's a metric, and how can we measure it, and how can we quantify it? Does it need to be quantifiable or quantitative, or can it be qualitative? So we actually sat down and documented this. This is really important to document and have this all done. Important feedback to the individual technicians and managers about the success of the process to that point. So basically what this does is it gives the managers an idea when we get these metrics in place, we could actually now sit back, the supervisor, and evaluate the process by the metrics and determine that it's happening right, rather than just giving it to your best technician and saying, oh, he's the best, we're gonna get to the end, that's gonna be great. You actually could have other people doing it and have metrics in place on a database that could say, you can go into any time and say, oh, it's working great. We're well on our way. We're a quarter of the way through. You can respond to the client and say, quarter of the way through, this is working really, really good. And you can start to build excitement in that. Yeah, and also the data is helping in tracking and generating more consistent and reproducible process. So basically, those little metrics help you as time goes on through looking back historically at the data and determining that yes, back then we worked with this really, really hard target, and now we're going to be working with it again. We're going to use a similar strategy, and we know that our process will work for that. So that was the other thing that their team brought in terms of developing this process and making me and our entire team understand process. Then finally, their team tried to hit the home run, or actually a little shotgun approach, and try to do a predictive modeling for us too. So I don't know if you remember that one, Frank, but that was a little hard. They tried to take our metrics and decide if they could be predictive, almost like forecasting in business revenues next month, right, Devin? Yeah. Can we take these statistics and build them into a model? And we were moving in that direction to seeing if we could actually forecast in advance success or non-success. And we still think we can probably build something like that if we have time, but we're actually really quite busy right now with a lot of really important diagnostic clients. So maybe when we get some time to evaluate that data, we can revisit the model. But we were trying to build a model that we could sell clients on, but I think we do a pretty good job of that with how we do our approach now in our process. So those were all of the concepts that Frank's team brought to us. They brought process, they brought an understanding of process to me personally, and I thank him for that. And that's really what it was all about. And for us, it was really about method on the left, reproducible, efficient process on the right, and good thing there's bridges. Wonderful thing, these bridges, right, Frank? Where Frank and his lean manufacturing group was a bridge when we were having problems. And that's all I have to say, and I just wanted to thank you for allowing me to speak before you today. And now Nick is going to finish up here.
All right, thank you, Randy, thank you, Frank, and thank you for all for being here. Again, my name is Nick Wiegert. I'm the lab manager at Neoclone. Make sure I'm on the right slide, okay. So I'm just gonna talk to you a little bit about how Neoclone applied Frank's ideas to our internal process. One of the main goals that we had to do, we wanted to improve the process through and through, the whole process. And we really needed to also complete this process transition that we had started once Randy arrived. And one of the big requirements of this was that we really had to have an open dialogue amongst everybody at the company. So we had all these meetings with Frank, and I'm not gonna lie, there were some disagreements, there was some butting of heads. I remember looking at Frank and just kind of thinking to myself, Frank, what'd you do to us? But it all worked out great in the end. Everything was worthwhile. And we basically concentrated on 3 different components. And they've all been mentioned already. Mainly the process map. We looked at all of our standard operating procedures. Then we looked at the creation of the metrics associated with the SOPs in place. And then we also wanted to look at the communication within the company, because our process has a high level of customization to meet our clients' needs. So we also had to have a very high level of communication between management and the employees. So first is we've really had to do a fine-tuning of our process map. And this was bringing in the technicians, myself, Randy, Devin, everybody was in there with Frank, and we just hashed out from SOP right from the start all the way to the end. And there were some long meetings. They were very worthwhile. Basically, we ended up remapping our entire process. And so we found out that we had to write some more SOPs here. We also had to break up parts in SOPs, and we also had to, we could combine some SOPs, also increase some efficiencies. Mainly what we really wanted to do here with the SOPs is we wanted to prevent the moments that happen in everybody's labs where you look at somebody and go, you're doing what to the cells? And so it worked out just really good. Another byproduct of the process map and fine-tuning was you get a really good accurate cost analysis. I'm not going to talk about that too much. You can really find out your costs internally and then in turn bill accurately. And then we focused highly on metrics because we did not have very many metrics in place at all. And so basically we had to identify some key SOPs where we were executing and where we had really wanted to make sure that errors were decreased and also that variation was going to be minimized. So the metrics were added to these SOPs with the main idea of tracking the technical ability and the accuracy of the employees. And coincidentally, at the same time that we were meeting with Frank and going through this process, Neoclone was in process of developing an online antibody development database. So basically this tracked the progress of our projects, tracked all the data, and then we were now, luckily enough, we were going to be able to add the metrics to it. And it was going to be very useful in looking at the metrics and how we could apply the results from them. The example I'm going to really talk about is fusion efficiency and a couple definitions. Fusion, it's a process where an antibody secreting cells are combined with a myeloma cell line, essentially immortalizing them. So we're creating a hybridoma cell line, and it's able to grow forever and ever. You can split as many times as you want, hopefully. And then fusion efficiency itself, it's a value, it's a percentage reflecting the frequency of immortalized cell colonies, the hybridomas. And so basically, in order to get the fusion efficiency, we had to have an impartial technician or supervisor look at the plates, we call them the fusion plates. So it was not the person that actually performed the fusion. And here's a couple screenshots of what, this is the actual fusion worksheet that we use. So you can see with the orange arrows, the actual fusion efficiency metric. There's a number of different other data sets here that we collected. So the fusion efficiency was basically look at 10 random wells, and if there are hybridomas in 8 of them, then you got an 80% fusion efficiency. And then there's a screenshot on the bottom there of the tabular format. That's the readout where I can go in and I can actually visualize. And here's one project where we had 3 different fusions, and then you see down there, down at the bottom, if you can see it, we actually had a 20%. So, and this raises a red flag, this metric. And so we looked at it, and basically low values will lead to a detailed evaluation of the executed procedure. We have to figure out what might have happened in the procedure. Maybe it was a bad reagent that was used. Maybe there was actual technical error that occurred. So, and if we ever see consistent low values for a single technician, it would end up leading to a technical evaluation or a procedural audit. We have to make sure that there's not any major problems going on with either the process itself or the technician. And then communication. Since Neoclone had a very high level of customization, it did require a very high level of communication between management and the staff. And also, Neoclone prides itself on the customization that we provide to the clients. We really believe that it sets us apart from a lot of the other companies out in the marketplace. So we really had to stress that internally as well. One of the ways we did this, we created a project worksheet. Before Frank, it was a 2-page document that went out to the technicians. After these discussions with Frank, it ended up being a 5, 6, 7-page document. It was an all-encompassing document that gave the technician and the management a way to coordinate and execute everything the way it should be done. It would provide project scope, the purpose, what we were actually making the antibody to, it could give some description of that. It would provide screening dates, shipping dates, and all the addresses. It was an all-encompassing document. And then we had work orders. We came up with this work order idea in the talks. We didn't have time to fully execute on it because by this time Frank had given us so much to do. We were somewhat overwhelmed, but we tackled it all. Basically what the work orders did is that we have a post-antibody development phase. The client selects an antibody that they like, and they'll come back to us and say, now we're ready to go into production phase. We want more of this antibody. And so what the work orders did, it provide A to Z, all the standard operating procedures that needed to happen during the work order. And it was a way to communicate that to the employee so that there were, again, the common theme, we had decreased errors and we limited all the variability within the process. That's it for me.
Well, great, thanks. And we have about 5 more minutes left before we go to our networking session. I'd like to open it up for questions, but as we do that, we're going to have a microphone because we are recording this. So if you have a question, we'll scurry the microphone to you. So are there any questions out there as we start? Great. Yeah. I get to be the moderator too, so, you know.
Can you give us a sense of how you dealt with metrics for biological variation? So an obvious example might be you're using living animals and they have a diurnal rhythm, so do you make sure you harvest a spleen at the same time any day you're going to do manufacturing?
To some degree, you can adjust the animal cycles. Our animal room has lighting and everything adjusted, so it's constant throughout the entire year for the exact amount of day and nighttime. Temperatures are maintained in our animal room, so our animals are very well controlled. They aren't part of the metric in terms of the actual development process of the antibodies, and they're actually more of a black box that in terms of immunization strategies and antibody strategies are more important in terms of the animals. In terms of biological with the cells, and diversity and changes within the cells, we do that is like efficiency is one of our metrics. We do have a lot of metrics that are measurable, lot number variances in terms of serum lots, qualifying serum lots, other types of things. So we're trying to add more and more of that all the time as we move more deeply into the process and development of process. But the trade-off here is you got to keep in mind is process is developed in a small company, but process is the building of infrastructure. And there's also a huge problem you can have if you build too much infrastructure before revenues are supporting it, because then you're using venture money or you're using your investors' money to build infrastructure. And I've been with companies that have done that, and it's really a sad thing because you end up building this really great pipeline justifying why you can grow in the future, and then all of a sudden you have nothing to put into it. So just be careful of that as well. Sorry to sidetrack there. Go ahead.
That's great. Another question in the back.
I think it's true that it's not always just making antibodies for customers, that you're trying to identify niches in the market that are bigger and better than that. Is that true? And if so, how do you do that?
Great question. And Neoclone's particular strategy right now is we do have particular diagnostic interest in the areas of traumatic brain injury and ovarian cancer for a variety of reasons. But as Neoclone looks at the market, our ultimate focus is to be in the therapeutics market space, which fundamentally means we need to advance our current technology to be able to produce antibodies in a way that are relevant in that market space. So for us, kind of the next market focus or the big focus of the company is to begin to service that market space.
And I could add just a little bit. We also have on our upfront, on our diagnostic clients, we have a bioinformatics, and the way we approach our clients also is a little bit unique in terms of how we integrate our research team into their research team. That makes us now bright and shiny in a different and new way and more attractive to the diagnostic client.
Next question here.
So how long did you work with Frank?
Seems like.
Forever.
It just seemed like forever, but yeah, go.
It was a lengthy project. I mean, these kind of projects, it would be on a bit, off a bit. But I would say, almost 18 months. And it was awesome. Those guys were great. We really did have a good working relationship with them. And everything they said that was possible, that Randy was looking at and walking in the door saying, no way. To a large degree, we have been able to leverage everything they did. Yeah, we are very, very appreciative of the UW system for lending us such wonderful resources.
So
Can you call the governor?
We call the governor a lot of things.
did you, after you stopped the intensive interaction, did you backslide? I mean, do you continue to do all the things that you were doing early on?
Basically, with the quote-unquote able-MIC process, there's absolutely nothing done that is the same.
No, I mean, with the new work you did with Frank, you were all fired up, and then do you still do it all?
Yes, we not only do it all, we continue to implement and move further in the direction of becoming more GLP-like every day and more possibly someday GMP-like.
Other questions? Working our way over here. I'll ask one while the microphone works its way that way. You know, one of the concepts of process improvement is that once I create new capacity, I backfill it. Otherwise, I don't realize the value for that improvement. How are some of the ways that Neoclone has used your newfound process efficiency to create more business, in essence?
Absolutely. Yeah, we now service a client level that underneath with our previous technology just simply physically wouldn't have been possible. So yeah, it's exposed us to a lot more opportunities. Neoclone suffers from a lack of market budget that allows us to necessarily go after that, but to the degree that our ability to service the high-end client has leveraged our reputation, we've been very, very fortunate that way. So yes, it is absolutely, without a doubt, helped us increase market share, without a doubt.
It's also helped us add additional technologies within our company. So we've added in a lot of different characterization processes, ways of characterizing the antibody, unique and novel ones that other companies don't have. So we're kind of more of a one-stop shop in terms of you can get your antibody and now we can characterize it in these new and unique ways that we couldn't before, and those weren't part of the process before at all. So it's given us more time and efficiency to do that.
Microphone there, and then we'll have two more as we finish up.
Now, I've followed your company for over 5 years and invested in it. And what I have a question more focused on, when was this an appropriate technology or influence that came to the company? Didn't it require the 300 customers first so that you had something that you were routinely doing before you could bring this type of formalization into your company?
Yeah, there was a leap of faith that Devin clearly had to make, and me, and my understanding of the vast amount of experience that I have had in building core facilities, first of all, at the medical college, where having gotten a patent with Miller Brewing for having built several of their detection systems for brewing proteins, worked with pharmacy biotech. My list of credentials was very deep in terms of developing antibody processes. I knew I had the highest and best throughput system coming into Neoclone, so part of the arrogant side of me, we don't have ego, was that my system was 10 times better, and I wanted to be proved wrong here. So it was, that was.
The other thing, too, that's very important to note on this, Byron, is that our products business all started from Dick Burgess's lab, and those antibodies were excellent and continued to be excellent. So that feature, by allowing us to sell those antibodies, which didn't produce huge amounts of revenue, but helped us spread our reputation in a quality manner, that was the piece that ultimately saved us through the not doing such a great job of delivering an industry to then bringing in Randy and then turning that around and really accelerating the growth in that area.
And you got to remember, too, we had to say we were wrong, we were sorry. Well, we had to do something for those people. So that basically meant we had to redo our entire new process with their old work and their old projects. So we had to do double duty as we were developing the process. So the first couple of years were incredibly painful. Yeah, absolutely. It was a hard time for us.
Incorporating the processes has actually two advantages. One we have discussed. It's pretty obvious. You know, you're more efficient, you can address customer needs better and so on. But the other very important one is that Neoclone develops processes, potentially therapeutics, diagnostics, and those are heavily federally regulated. And without a process, you know, you can't get regulated. And so my question to everybody up there, especially the guy in the red, is can we go from this process that improves the manufacturing to a process upgrade that gives us ISO 9000 or something like that? Or later on a GMP certification?
Yeah, one of the companies we worked with was a GMP company, and they already had processes in place. They weren't necessarily very effective, and they were already complying with regulations, okay? And so we were able to work with them and make significant improvements in their process. that reduced dramatically their lead time and eliminated a lot of false starts within their company. So if you want to become ISO compliant, if you want to comply to FDA regulations, it's important that you not only have processes, but that these processes are controlled, okay? And you have to demonstrate control of your processes. So they're repeatable, they're robust, and it's pretty much the approach that we took going into working with Devin at Neoclone. Does that answer your question?
I,
How far would we be away from getting ISO or GMP?
Oh.
On top of what has been done?
Well, based on what I've seen where Devin in the group here has gotten their company, it would take some work to get ISO certified, but they're in pretty good shape. I mean, they've got great documentation of their processes. Their processes are well controlled and produce, reliable, high quality results. So basically, they'd have to go through the certification process, which requires, having somebody come in and evaluate their processes and give them an audit report before they,
that smells suspiciously like overhead, which I'm not interested in just yet.
yeah, I mean, but wouldn't you agree that your processes are in pretty good?
Oh, yeah. No, it is certainly something that as we consider our strategic, future, that we absolutely will be looking in that direction. And I think will become necessary at some point. I just don't think we need to go there quite yet. But everything that we're doing now, no doubt, builds us in that direction.
Yep.
Without a doubt.
And we had one final question right here in the front.
One of the slides, I think it was Frank's, discussed catalog products, and it looked like that wasn't being put in a very favorable light. So I'm just wondering, is there anything inherently wrong with working on catalog products, or is it just that that doesn't have the same sex appeal that custom-made work or research might have?
No, I'd say catalog work is great, and the more catalog work and the more products we can develop, the better off we are as a company, because your margins are written into your catalog products. And that's really where it's at. So in terms of building big value, in terms of reagent sales, if that's where you're after, that catalog is really important. But you got to remember, we're a multifaceted company with service catalog, and we're going for that big home run with the human antibody platform. So we're trying to satisfy a lot of different needs with one company.
Okay, well, thank you, folks. We've come past time. I'd like to thank our great panel today. A number of us will be at the reception because I understand they have beer there. And the way to get engineers to a reception is to have beer. It's the two E's in beer are like engineer. So please feel free to pull us aside and talk to us about issues and how we at Engineering Professional Development and the folks at Neoclone can collaborate on more projects like this. And then I'd like to turn it back over to our host for the evening. Thank you.
Thank you. Thanks so much. And I want to thank Frank and Carl for actually approaching us to let us know in the Gilson Planning Committee about this fabulous resource. So it's a great addition to our dialogue. Before you run off to the reception, a couple of housekeeping things. First, I want to flag for you some of the upcoming topics. You will get an email tomorrow morning, again, if you're on our mailing list, about a Gilson event coming up 2 weeks from tomorrow on social media marketing and effective use of web tools, which will be very engaging. We have someone from shopbop.com who's going to be running that discussion. And then a couple more sessions planned later in April. Both of those are likely to be held at the Fluno Center because the town center has already been oversubscribed. We're just in our first year of operation, and I can't get in to plan anything in April. So it's good news, bad news. So we'll send out reminders about that. Tomorrow you will also get a quick online survey that will help us continue to develop this series and identify additional topics and give these presenters some feedback on how they did and what you learned from their event. And lastly, before you head to the reception, if you don't already have a name tag, please grab one. That's basically your ticket for entry. We have a lot of students who like to hang out here, and they're very savvy at figuring out where there's beer and food. So grab a name tag, and there are many of the Gilson series organizers here as well. Dan Oshevsky from the Business School, Eric England, Alan Dines, and Vicki Iden from OCR, and I see Kathy Collins from BioForward, and they're there as well to talk to you about the series in general, and of course the panelists. So thank you again for coming, and have a great reception. Thanks.
you, Julie.